So thanks a lot. What I wanted to talk about today was how we are introducing craft into our workflow for process impurities and leachables in biopharmaceuticals. So biopharmaceuticals, we're talking protein-based therapeutics. And so this is definitely not a talk about the nuts and bolts of craft. Krish is sitting virtually in the room. So, you know, he's a great resource for this. What I just want to do is I want to show an example of how this enabled us to do something that we weren't able to do before and that we actually needed to do because of the changing landscape of regulation in this kind of area. So let me just walk everyone through why we need to do this, what we're doing, and how craft improved it. So just to kind of set the stage here. So in biopharmaceutical processing, health authorities really require us to demonstrate that our products are safe of impurities, whether they're from raw materials or the purification process, or even leachates from contact materials. So when you make a biologic, you know, it's really shocking to see that there are literally hundreds, and in some cases thousands, of raw materials involved in this process. So it's everything from the cell culture materials to the process buffers to actual equipment that touches this product as it goes through the purification steps. And some of these things may actually also be leachables from filters, resins, tubings, and other contact surfaces. So this has been an issue for a long time with biotech kind of products. But what has changed recently is there is a strong move in the industry towards single-use process equipment. And when I say single-use, I mean disposables made of plastic. And these things are preferably sterilized with strong radiation. That makes things even more complicated. So the good news is, over the past few decades, the industry has developed some really good ways of dealing with these impurities, whether they're from disposables or not. And in my group, NMR has been the first line of defense for these things. And I'll show you why that is. And recently, we've added craft processing to deal with some of the challenges from the single-use equipment. So with this audience, I really don't need to sell NMR to you, but when I show this stuff to our process engineers and quality folks internally, or when we show this at general forums that involve bioprocessing or biotherapeutics, really the first question I always get is people say, well, why are you using NMR? You know, we use, 50 different HPLC assays, or, with leachables, we just use GCMS and LCMS. And so the answer that really surprises people, but shouldn't surprise us here today, is that NMR is actually a really good way of quantitating small to medium-sized molecules in protein-based drugs. You don't have to adjust the buffers and the gradients in an HPLC assay. You don't have to figure out, okay, how many detectors can I tack on to the end of there, whether it's UV-Vis or CAD or ELSD or mass spec. Really, anything with a non-labile proton, we should see. And what also surprises people is the rapid increase in sensitivity. People view NMR as a very insensitive method. And so this is kind of a bit of an outdated table, but if I look back at the history of my group, and in 1995, I wasn't here doing this kind of stuff, but they were doing this kind of stuff with a variant ANOVA with a room temperature probe. And although these install specs they met, they're kind of somewhat marketing tools, they hit 575 to 1. And over the years, we've upgraded the equipment, and we end up at a place where we're getting much higher sensitivities. Now, these are ideal sensitivities, but I will tell you that the sensitivity we achieve in our real world samples follows approximately this trend. And so, we've gone from earlier generation cryoprobes, and not listed here is a NEO with a new cryoprobe. These things work really well for this purpose. They have good sensitivity. They behave better in terms of solvent suppression. And so this is what happened in the NMR lab part of my group. The number of process samples for impurities and other things looks like this. And so I stopped keeping track of this a few years ago, but a few years ago, we hit 30,000 samples a year. And these are samples where we're looking at microgram per mil or tens or hundreds of nanogram per mil impurities in very complex solutions. So that 30,000 samples is a lot of stuff for us to sort through and look at tiny peaks and process. And so we went from being sensitivity limited to being process and subject matter expert limited. So here's what it looks like for us. The biotherapeutic purification process and production process starts at cell culture and goes all the way to final formulation. And in between, there are a bunch of chromatography and diafiltration purification steps. And all along this process, we are using NMR either to look at solution components in the cell culture or look at how they're cleared, make sure we're not leaching stuff into solution. And at the end, when we dump a bunch of sugar and maybe polysorbate in there, I do like to throw in some separation techniques as well, just to make sure we're not missing things underneath these large signals. But all along this process, we've found places where craft helps us do this stuff better. And in some cases, it is helping us do things that we couldn't do before. And that's what I want to show you today. And the complication here is once these disposables come into play and they blast them with radiation, the impurity profile actually gets a lot more complicated. And that's where the big challenge comes in for us. So how are we doing this this work in general? Well, for the past 10 years, we've been doing things like this. So this is a spectrum of one of our drug products. And I did spike in 10 microgram per mil of a few things just so they're easily visible. And the top and bottom spectra here are the same sample in the same NMR tube. It's just in the bottom, we've applied a CPMG to get rid of the vast majority of the signal from the protein. And when you do that, you can see you get a really good shot at all the small molecules in there. So, and then if I move this down to a microgram per mil, you can see that even at a microgram per mil, this acetate and the various other spikes are giving very good signal to noise. In fact, if I didn't do a spike at all, it looked like this. So you can see there are actually some impurities in this drug product pool. For instance, acetate and acetone and tris were present at a few hundred nanograms per mil. I didn't label it here, but this guy about 3.3, that's methanol at about 100 nanograms per mil. So we found that this is actually a really good way for us to get at all the impurities in these protein therapeutic pools. And I should mention that in some cases, the protein in these pools can be up to 200 milligrams per milliliter. So it's 20% of the entire mass of the sample can sometimes be protein. So we don't want to filter them out. We don't want to crash them out. That is a lot of work and is sometimes really not that successful. So we then started thinking, can we do this processing and work by craft? And so the first thing we tried were those same samples. And this is some of the earliest crafted data from our samples. And in fact, the initial question, will we see these at all if we don't use a CPMG? The answer is yes. So this is that same stuff at 10 micrograms per mil. You can drop down to 1, you can still see it. Even without the spike, you can still see these things at a couple hundred nanograms per mil. So these are craft reconstructions. The real craft data is tables of numbers. But the thing that I will tell you, and I think we all know, is tables of numbers don't make good slides in a talk. So every time I show you a table of numbers, I want to show you maybe a more easy way to visualize it when you're listening to a talk. So this is what we get when we compare our traditional CPMG, then a Fourier transform, then integration versus craft. So blue is our traditional workflow, orange is crafted results. And as you can see, across a wide range of concentrations, we're really getting essentially the same quantitative results. Are they exactly the same? No, but they're not meaningfully different in a way that a process engineer would care about or our toxicologists would care about. So this is tris. You get the same thing with acetate. You get the same thing with propylene glycol. In fact, I will tell you, we've looked at many small molecules, and we're always really satisfied that yes, when we skip the CPMG and use craft, we are getting similar results to our old workflow. Okay, so craft would be a nice to have if we were dealing with fairly clean pools like I showed you before, but things are changing in the bioprocessing industry. So for those of you that have used craft or played around with it, you know, there are a lot of really nice things about craft. You can potentially overcome peak overlap. There's maybe the potential to eliminate subjectivity because I might choose to cut an integral a different way than someone else would, especially when peaks are crowded. But what I want to show you today is a success story where we use this for rapid processing of complex data. And this is really driven by what I mentioned before, the move to disposables in the biotherapeutics production. So you might think, and I did this, I thought this at first too, why are we going to disposables? Isn't that wasteful? But the fact is it's cheaper, it's faster, and it's actually more environmentally sound because the bar to reusing process equipment when you're giving real people these drugs, especially through an IV route or maybe sometimes even injected directly into an eyeball, that bar is really high. So when you clean equipment, you're going through tons and tons of solvents, tons and tons of buffers. It all goes down the drain, and it is very costly in a lot of ways. And last but not least, there is also the move to personalized medicine. That this era is just about upon us now. And so there is no way that we can reuse and clean equipment for every little tiny batch of RNA-based medicine or cell-derived medicines that we give to patients. We've got to use disposables. There's just no way around it. So in that way, disposables are actually really good, but they're made of plastic. They're new, they may have manufacturing residue, and our manufacturing folks really love to blast them with radiation. And so plastic plus radiation, that is a little scary, right? And so let me show you what the manufacturing engineers love. So this is the very end of one of our new disposable filling lines. It's a fill assembly. The engineers love it. They put it on, they pressure test it. They go, it doesn't leak, it fills everything really great. And then we as spectroscopists and chemists look at it, and our toxicologists look at it, and we freak out because we see that it's made of polyethylene and polyolefin and polysulfone and silicone and polypropylene and polyethylene and so on. And then they blast it with high amounts of gamma radiation. And we're worried about what we are going to see going into the patients. And in fact, you do see a lot of stuff. So the bottom spectrum here is a process. It's a buffer that's used in one of our experimental products. It's a little bit busy, but as you can see, if you look at the top, this is what happens to this buffer when it goes through this fill line. In fact, there's a lot of extra stuff in here. Some of it's obvious, some of it's not quite so obvious, but we do see all these things and more coming out of this fill assembly. And these things persist. Even through 10 liters of fill, they persist. And this is something we have to pay really close attention to because we don't want patients exposed to unsafe levels of these things. We have to run these by our toxicologists. And we also have started coming to the realization that these single-use items are actually behind some of the particle issues that are popping up in the biotherapeutics industry right now. As people move to these, we're seeing more particles form. And no one likes to talk about it, but I do hear things, right? And I think some people are starting to realize that, yes, this is a cause. Other manufacturers seem to not be aware of this yet, but this is a real challenge and it's not going to go away. So I did run some pure water through this fill assembly as well. And just so you can see how bad this situation is. So the bottom is water, and the top is the same water that went through this fill assembly. It is a fairly complex mixture, and we need to characterize all of this, often in the presence of protein-based therapeutic. So this gets a little difficult. So when you're talking microgram per mil or nanogram per mil levels of impurities, we can play all the tricks we want with our acquisition setup, our processing setup, our baseline setup. We never quite get to the point where we get these integrals behaving the way we want without a person intervening and adjusting the slope and bias. We try the best we can to not have to do that, but really there is always a lot of tweaking going on when your peaks are tiny in the presence of really big peaks and you're using a cryoprobe and stuff like that. And so that is labor intensive. So imagine this situation, and this is a real situation I encountered last year. Our process engineers sent us 150 samples from an experimental fill line. Now, the amount of leachables we got out of this wasn't nearly as bad as the one I showed you before, but we still needed to characterize all of this. And so I sat down and I started integrating these spectra. I did a few of them. I did my very best to, tweak the integrals so that they're as flat as possible, cut them where I best thought they should be cut. And when I had done a few of them, I pulled out my calculator and I calculated how long it was going to take me to go through 150 of these and do a really good job. And it turns out it was going to be 22 hours. And there were more samples coming the next day. And at that point, I kind of realized, okay, these single-use things are not going away. And this is not a sustainable situation for us. So at that point, I said, okay, this is a candidate for our in-progress craft workflow. So I loaded up all 150 spectra into craft, and I spent about 14 minutes, mostly assuring myself that these things were referenced equivalently. And then I dumped it on my rather modest laptop and came back the next day and found that my laptop had chugged away for about 10 hours. And when I compared the ones that I actually had integrated to the craft results, the results were essentially equivalent. They weren't different in any way, especially given these very low levels that a process engineer or toxicologist would care about. And so that was really assuring to see that even at these very low levels, just letting craft software do everything without any kind of intervention from myself was potentially going to be a game changer for us. And so, this is the first 25 of those spectra. You can visualize them like this, but really craft is numbers. And so we extracted the frequency and amplitude per sample out of these things, ended up with something like this. Of course, you can't read this, right? Numbers make horrible slides. If I zoom out, you'll find there's actually more data. If I zoom out, you'll find there's actually more data. What I ended up with was a giant matrix of frequency versus sample with amplitude data. And in the end, this allowed us to report every single thing that was in there without much intervention of a real person. So let me give you an example. So then the engineer started saying, okay, thanks for that. Is there any place where the impurities are not consistent? So we use a fill assembly, we replace it for the next one, we replace it for the next one. Are things changing? Because if there's one thing that's worse than having impurities in your drug, it's having different amounts of impurities from run to run. And I said, yeah, there are, and it's easy for me to show you. So all I had to do to make this graph, which is a representation of how much isopropyl alcohol was coming out of this fill line, was select two columns, because this is the CH3 of isopropyl alcohol and it's a doublet, and paste them into a different part of the spreadsheet. It literally took me 3 minutes to make this graph. And so as you can see, when they got to run 5, the 5th fill assembly on this line, isopropyl alcohol spiked to 100 times its previous concentration. So there was some in here even for the other runs. There shouldn't be, but this is really alarming. And this is what is really helpful to screen our prototype fill lines. So we did this for acetone, we did it for all these other things, but having all that data there without a person having to say, okay, which peaks do I really need to go after? Can I save some time? This was incredibly useful in terms of us figuring out how to fix this problem. You can probably guess that either someone in the manufacturing plant, in this case, sprayed with isopropyl alcohol, or our supplier messed up. So I'm not supposed to say, but it was a supplier. You know, here's the real point of this. We don't want a person manually going after thousands and thousands of peaks and then doing it the next day and the next day and the next day. We're in a situation where we're going to have much more complicated impurity profiles. We just need to be able to get this data and use it to either fix our problems or show health authorities that, yeah, our process is under control. And that's where Craft has enabled us to tackle the single-use implementation in a way that we weren't previously able to. So where does this leave us? So aside from the other benefits of Craft, we have found this to be almost essential for this kind of work. So if we're going to go through hundreds of samples with thousands of peaks, we need to be able to do this without people spending all their time just sitting there and integrating and tweaking the integrals as best they can with their best judgment. So in terms of the single-use transition in the industry, this is really a game changer for us. But we still have questions that we're thinking about. We potentially get a lot more data than our old workflows because we can potentially just craft everything and then decide what to do with it later. So do we craft everything? Do we craft some stuff in a regulatory situation? Do we report all the data? Or do we just give the health authorities the data that we use? These are big questions that we have to answer, and we don't quite know the answer to them yet. In the end, we will figure them out because this has been very good for us. The other question is, you know, what is the optimal software mix? How hard are we going to try to tie Craft back to other software packages like Topspan or MNOVA? Do we just write our own scripts and leave it in OpenVNMRJ? We're not sure yet. And I think this is where we're interested in seeing what other Craft users do for this kind of stuff. With that example, I hope that maybe inspires other people to share their stories of what they're doing with Craft. We're certainly interested in seeing it. I would like to thank the members of my group in the NMR lab, Gennady, Caitlin, and Matt. Noah Wake has left us to do his PhD. Jay Du is in the GCMS, LCMS part of my group. He's fantastic, and he provides a lot of orthogonal data for us. And of course, we'd like to thank Krish and Dan. We've picked their brains more times than I can count, and they've been very helpful as we try to learn how to use Craft in a way that's useful for us. All right, that's all I have.